Um, thanks again for this opportunity to talk about some of the stuff that we've been doing, because we've been very active in this field. I think that perhaps the most one of the more interesting things that we've done, which started actually before Corona, we started a home hospital project where we actually take patients who need to be hospitalized in our inpatient wards. We see them for a day just to make sure that there's no immediate danger. Then we send them home. We send them home with a tablet, with a smartwatch, and we examine them every day with and we treat them just as if they were in the hospital. So a nurse will see them several times a day. We'll be in touch with the family, social worker, psychologist, a psychiatrist. We'll see the patient every couple of days, just as the psychiatrist would see him or the patient as if he or she were hospitalized. We've at this point treated several hundreds of patients using this technology. The patient also gets a smartwatch which records his sleep, pulse, blood pressure, etc., ECGs, and we're really able to do a home psychiatric hospitalization. This is something that, to the best of our knowledge, is quite unique, and we don't know of anybody else who is doing this. Certainly not at this level. So that's one thing that we actually started years ago before Corona. And during Corona, it of course became extremely relevant, given the difficulties in social distancing, et cetera. We've recently published this technology with our patient experience in Frontiers of Psychiatry. It's available online for anyone who's interested. We're now expanding this. We were just doing regular patients who need psychiatric hospitalizations. We're now expanding this to patients with in special areas of psychiatry where this can be very relevant, patients with eating disorders, patients with psychogeriatrics. This is extremely relevant for psychogeriatric patients, elderly patients who have difficulty in the hospital but are not doing well, and we can really see them, monitor them, be available for them. And it's really a very special project. It's being led by my colleague and dear friend, Dr. Asaf Kaspi. We're also beginning to we've been treating women with postpartum depression with the same technology. We've been working a lot using, and this has now been something that we're talking about for many years. Israel has the opportunity, because everybody has a unique identification number, you're able to use this identification number across different databases, and we've been linking these across different databases. So already many years ago, we published a series of papers, looked at what a 17-year-old who was assessed by the Israeli military but was later hospitalized in a psychiatric hospital for schizophrenia, how he differed from the guy who was assessed right before and right after him in the Israeli draft board. And we've made some quite important contributions to science with this big data. With this big data, we continue to do these studies. For example, about a year ago, we published a paper where we linked national data on COVID-19 with national data on psychiatric hospitalizations, and we were unfortunately showing that patients with schizophrenia did very poorly during the pandemic. They were more likely to be hospitalized and more likely to die if they were ill with COVID, became ill with COVID.